to make them aware that light can have an effect on their health and well-being. And this first video is of course already ready, and you can find it on the ENLIGHTENme website. Additionally, as part of the stage 1, we also prepared an infographic and a postcard, and both of these materials are explaining the project's aims and objectives, as well as highlighting why the work of ENLIGHTENme is so important. And both these are also available on the project's website. And again, this was all prepared together with what we call our communication committee, which has representatives from all the different work packages. So it was really a collaborative approach preparing these materials. And this was then all complemented with a social media campaign as well, where we took some facts from the infographics, and these were then shared over a period of time through the project's social media channels, so Twitter or X and LinkedIn. And then at stage 2, this is currently under production, and this will be finished until end of February when the project finishes. And here for stage 2, we of course are focusing more on the learnings that have come out of the project itself. So here for stage 2, the aims were to offer tips and recommendations for how to reorganize lighting in the homes, and really to allow citizens to take control of their home environment so that they are in control of their lighting and can help improve their health and well-being. And central to this stage of the campaign was a flyer, really offering citizens guidance to conduct a kind of very brief lighting audit in their home, and then recommendations on how to make small but effective changes. So as we've already learned from the previous presentations, there is no one size fits all when it comes to lighting, and therefore this flyer is more in the form of providing some guidance to inform citizens of how they can think about lighting in their homes and think about, well, how does this lighting make me feel? Does it help my activities? And then giving some guidance on how that they can change the lighting. And this flyer will be available on the ENLIGHTENme website and be available in various different languages, including English, Dutch, Italian, Estonian, and German. And we're also going to be printing it out and distributing in our ENLIGHTENme cities, so that also the citizens that have been involved in the actual work will also then get these flyers and can then directly benefit from the learnings of the project. So just to show you what the flyer looks like, so we have named it Take Control of the Lighting in Your Home for Better Quality of Life. And as I mentioned, it takes the form of kind of an audit or a checklist where we ask citizens to, well, what do you actually want to do in the room? What exactly or where exactly? How would you like to feel in the room? And what are the lighting conditions? So making people aware of, does the lighting in that specific scenario actually fit with the activity that they want to do? And then we have highlighted some things that they should consider, for example, the brightness, the color temperature, is there a glare, what is the position of the lighting, the direction, and then we outline some recommendations for how that they can change this lighting to better suit their specific activity. So it's really about letting citizens know that they can change the lighting to better suit their activity and hence take control of the lighting within their homes. And as mentioned, this will be available on the ENLIGHTENme website, hopefully in maybe next week or the week thereafter. We're just working on the translations at the moment, but the main English version is already ready, and there will then be a dedicated page on the ENLIGHTENme website focusing on this campaign material. Additionally, we've also produced some audiovisual material. And so firstly, we have prepared or currently just finalizing a video to support the guidelines. So this video has two main target groups. One is for the wider public, where we want to make them aware that their well-being is placed center stage through these innovative approaches, which are developed for and together with citizens. So it's really to let citizens be aware of what is how they've influenced these guidelines. And additionally, it's also targeting municipalities and policymakers. So it serves as a teaser for them to dive deeper into the guidelines in order to explore how lighting policy within municipalities and subsequently quality of life for the citizens can be improved. So this will also be available shortly on the ENLIGHTENme website. And lastly, we also have the video that was already presented by Don, so I don't think I need to go into too much detail here, but of course this video is focusing on the urban lighting labs and really just very nicely shows the work that has been carried out as part of work package 2 together with LSE and the cities, and really shows how how lighting innovations can help reshape these urban spaces. And as mentioned by Don, this video should hopefully be available next week. We're just again working on the translations, subtitles, and then this will also be available on the ENLIGHTENme website. And also, of course, we will promote it with our social media channels. So I would welcome you all to also follow us on LinkedIn. I think the link was already shared in the chat. And then, of course, you will know as soon as the video is, or all the videos and materials are available. So thank you very much.
Thank you so much, Patricia. I think it's really a great result in terms of dissemination of what we have achieved, and we have already underlined the importance of engaging people, citizens, to make them aware. So this is very, very useful to make the results of the project available to the wider public. Thank you a lot. If there are no questions, I would ask to Deborah to go on with the presentation about ethic in lighting, and Chiara will be...
Actually, Mirko Ancellotti will present this part, but I'll hear.
Mirko, thank you.
Here I am. I will try to... Okay, here it is. Please, can you confirm that I'm sharing the right screen?
You are.
Okay, thank you very much. Well, first of all, I would like to thank the organizer for giving us the opportunity to show some of the results of our work. We are the work package 5, that is the ethical and legal work package. We still have an internal function to the consortium to facilitate the good and responsible research, which entails that we took care of the data management plan, the verification of data, and consent procedures, and so forth. And then we had also another mission, that is that of research. And today I'm presenting some of the results that are connected to our work in the ethics of lighting. It's the work of Deborah Mascalzoni, the work package leader, and myself, for the most part. Now, talking of ethics of lighting, we had first of all to try to understand what it was about, what were the different areas of potential relevance, ethical relevance. And we have been doing this mapping of the literature and of also conceptual mapping, and we have focused quite a lot on the notion of light pollution and suggested adding, not using it instead, but to add to the light pollution framing that of light public health. The reason is that when we communicate, when we conceive ideas and communicate them, we always adopt some kind of framework, and necessarily something falls off of it and something is possible to have in it. When we talk of light pollution, we are immediately adopting an environmental framework, and while there is nothing worse with it per se, very often the environmental discussion are loaded, politically and ideologically loaded. And as we focus on the health and the quality of life and well-being issues, this is something that may not be conveyed, the messages about it may not be well conveyed only using an environmental framing. And finally, we provided a public health ethics framework. Where it is? Yes, this is the first area of ethical moral concern, the usage of energy, or perhaps waste of energy, that comes with the use of light, and the moral problems comes with the overuse of lighting and the pollution that is connected with it. This is a problem at present, and is a problem in the medium and long term. or this can be considered for ethicists or in other fields as an intergenerational problem, what we are causing through over-illumination, and of course also in terms of sustainability. There is issues, of course, connected also to the energy waste and the pollution problem that regard the fauna and the impact on fauna and flora is the immediate and direct effect of lighting on fauna and flora, and is also the indirect problem connected to pollution. If one does not really, not that we are not the same, we are not all the same, and some may not care about the impact we have, or for different moral reasons, on the impact that we have on animals and the environment, there is it's likely that we find an agreement on the fact that we still care about the loss of biodiversity that is connected to the over-illumination of the world. Easily understandable, there are also ethical concerns that relate to safety, accessibility, inclusivity of our lighting, of the way we light streets and domestic lighting. It encompasses both public, quasi-public, and domestic environments. The idea is that, of course, as has been said during this day and the previous one, urban lighting shapes public spaces and social life. It has a great impact on it. And we have to consider safety, perceived and actual safety that are connected to it. And the idea is that lighting should promote socialization and should also adapt to communities' needs and not be just a means for patrolling, controlling communities. From ethicists and philosophers, also the loss of darkness is something that is really relevant, and the connected loss of the so-called nocturnal sublime. Of course, there is an aesthetic facet of also artificial lighting. We can create beautiful things through artificial lighting, but that's not always the case. And what we have to consider is that we are depriving ourselves, often, not always, but often we are depriving ourselves and younger people and future generations of the experience, the cultural experience and the spiritual experience of darkness, basically. The last dimension is the one in which we focus the most because of the project and its potential magnitude, is the health, is the well-being, the quality of life, different terms that have been used, although we also focus on the specific impact on health and the ethical dimension of it. That's why we emphasize that it's not only a matter of light pollution, where light is considered a pollutant, and then you think of it in environmental terms, and propose this light public health as a framing to think and communicate about lighting issues. And we have produced framing starting from the public health frame, ethical principles that could be useful, hopefully will be useful to consider in very different situations, different type of light interventions. And they're heavily rely on the biomedical ethics principles plus one, a green one. The first one is the respect for autonomy, where, in our case, it means that lighting policy should empower individuals and communities to make informed decisions about their environments. So raise awareness, as has been highlighted also before, and so that people can better understand what would be better for themselves and their close community. Promote beneficence. Lighting policy should maximize positive health and social outcomes. So solutions that enhance public safety, encourage physical activity, foster social connection in public spaces, trying to do good through better lighting environments, both at home and in public spaces. And then is the other side of the coin, not cause harm through lighting. can be in the long term or in the short term. And as it's not possible to make everyone happy or satisfy the preferences of everybody, it would make sense perhaps to have to prioritize vulnerable populations. And then there is promoting justice. Light intervention should promote fairness and equity across all communities. So I think it can be synthesized into giving access to good lighting to everybody. Address disparity by ensuring equitable access to healthy lighting conditions. And then there is the so-called green principles, that is the One Health approach. We need to recognize the interconnected health of humans, animals, and ecosystems in lighting policies. We cannot just, or we shouldn't just, address them from an anthropocentric point of view, because in the long term, it's also bad for ourselves. So whenever possible, we should prioritize sustainable lighting practices, for instance, through smart lighting and smart decisions. That's all. Thank you very much.
Thank you very, very much. I think your work enlarges a bit our vision and focuses on this importance of keeping in mind who we work for. So the idea is really to have a comprehensive work, and we were just noticing how sort of magically everything is going in the same direction. So we work from very different perspectives, but it is very, very nice and interesting seeing now that we have a common result, which focuses on complexity, on individuals, on the need to be targeted and to consider all these different aspects. Chiara is now with us, so I leave her the floor, and then we have some minutes at the end for questions and any other comment.
Hi everybody. Good afternoon. Thank you for all relators who came before me. Thank you, Simona, and everybody for involving us as LCT Institute in this project. It has been a long journey, and very satisfied with us and all that we tried to convey. In particularly, I think I can show just a couple of slides. We had the task of organizing in the 3 pilot cities the LCT Manager Training Program that has been done twice, so therefore in along 2 editions, the first one last year and the second one this year. Our task was organized under the premises of what the LCT Institute based in Rome is doing at national and international level, which is some training programs and courses for local administrators and official, especially under 35, to spread the voice of trying to insert health in all policies. So we found the opportunity within through ENLIGHTENme to organize in 2 training programs to yes.
Sorry, we do not see the slide moving, so we are still at
no, it's just the same. Can you see now? Can you see it now?
No, we just the title, the first one.
Not in presentation mode.
Okay, I will try again.
Now it's moving, yeah. Thank you.
Okay. Okay, so our premises were the publication of the core curriculum of the LCT Manager, that is a professional that we create and invented in order to deal with the topics of health in cities that are marvelous laboratories in which to experiment our public policies and try to make them salutogenic places and not pathogenic ones. So the public lighting policies, public policies, outdoor and indoor, were a particular prism under which we tested this kind of training program, and we organized, as I've said, under the premises of the LCT Institute and the core curriculum in the cities. We inserted in both editions the opportunity of hosting also other European project. This is a scheme that summarizes and would like to summarize the role of the LCT manager in health in all policies approach when dealing with public policies and the health policies in cities. So the LCT manager is a professional that support local administrations and supports the process of the participatory process when dealing with public policies in health, especially in health and the study and monitoring of the terminal of health. It has the task to support local administration, the process, and to involve all the professional and the fields that are connected with the study of health determinants. So breaking the silos or trying to overcome them, we are confident about the effectiveness of these professionals also in arising the awareness concerning the health in the cities, as we have heard till now during this last meeting, but during as an objective during all the project. The two training editions were based in a program that we also shared with all the members and the pilot cities according to their exigencies, and on the basis that it should be multidisciplinary. So for instance, in Tartu, I don't know if my colleague Janus is still online to bring his voice, but it has been very, very interesting because on the first edition we concentrated on dealing with the study and the health availability figures in the city of Tartu, and we compared and we hosted a project that is called Cities After Dark to compare the public lighting and the night economy of the city in Estonia, particularly in Tallinn, that is another city that is involved in the project. And there were some participants that came from the city town and from different health and mobility departments. This year, in the second edition, it has been particularly successful because Tartu hosted a double number of participants, and we concentrated in having the speech of not only from Tartu, but from 3 departments of Tallinn that were concerning with the older policy, with the older adults in Tallinn, with the mental health problems for youth and general population, and from the department of from the health department. There was also the presence of representatives from the city of Helva that is completely different in terms of monitoring and availability of data and health factors, risk factor, because it is placed in a rural zone. So it has been very meaningful for us to combine the participants, the experiences and the expertise of these participants, and we hosted also the opportunity of having an overall overview of the situation in Estonia, thanks to the participants that was a member of the WHO, regional WHO. As for Amsterdam, it was more or less the same last year when we came to combine from different departments of the city of Amsterdam the opportunity of exchanging, and one of the main challenges they are confronting is the opportunity of make platforms, data platforms, the interoperability of different figures and data platforms that the city of Amsterdam have. So they have data, but they are still addressing and confronting in finding some methods to exchange and to plan, putting health as the objective and not as a consequence of the public policy in the city. And finally, we had the opportunity of organizing 2 editions of the Health City Manager training program in Bologna. Last year, it was there was a very numerous group of participants, and we had the opportunity also of hosting other EU project, and we did a 2 days program this year. We did also a 2 days program, but we, thanks to the cooperation of the University of Bologna and of the municipality, we divided into first day an upgrading or something, an opportunity of going too deep with the same group of last year, and the second day with a new group of participants. In both of days, we also the cross-sectoral experience coming from other European projects that the municipality of Bologna is developing, that was connected with nutrition, urban agriculture, and some other specifics that crosses the health factors and the health determinants in the city of Bologna. So it was very interesting to observe and to listen to the direction the city is taking and would like to reach the challenge is addressing. And it is very interesting because all the projects, the EU projects we hosted, they are all concentrating in the same neighborhood or in the same part of the city of ENLIGHTENme. So it was very interesting to continue to observe the change in this part of the city, thanks to the European project and thanks to the cross-sector and multidisciplinary approach coming from different level of intervention at public level, local public level. So the Health City Manager training program was first of all a way for us as Health City Institute to raise awareness according to the importance of studying the health determinants in cities, and on the other hand, a very wide and useful opportunity to exploit all the experiences that come from cities, and the opportunity of exploiting the public policy implications of ENLIGHTENme figures and guidelines, and trying to test the contents of the guidelines of ENLIGHTENme, because we tried in a laboratory way to confront around the effectiveness and the efficacy of the guidelines the ENLIGHTENme project has as an outcome, as one of the main outcomes. So as for the voice from the Health City Institute is for sure positive, and it is particularly positive for due to the fact that the contribution coming from different departments from different cities are very precious also for the sustainability of results and the continuity of the public policies for public lighting.
Thank you very much, Chiara. This final presentation led us to the beginning when we started to speak about the importance of cross-sectorial approaches, both in all the sectors and among the different institutions. I don't know if the cities would like to comment briefly about their experience. Marzia and Janus, you are there and you want to add something? We have some minutes.
Yeah, I'm Janus from Tartu. It's just very shortly because Chiara covered almost what we did in Tartu, but yeah, I can just tell that we had very fruitful discussions, and the topic of health city manager is for us a bit new thing, but there are some good highlights in Estonia as well. For example, in Tallinn city, they have established a new position is nightlife manager, which is a bit similar to health city manager, but with some implications. And then and we had many local municipalities on board, and also cities across the country, and also scientists. And in that sense, it was very interesting, very good, and novel approach for us. And we had maybe discussions what we haven't before. And yeah, it was a nice thing. And thank you, Chiara, of course, for organizing and
Thanks to you.
thinking. Yeah, thank you.
Thank you very much. We are now at the end of our public event and of
Simona, may I add about the organization of the health city management?
You are connected with 2 devices, probably.
Try again.
Hello?
No.
Okay.
No,
No.
Let's see if Marta is able to come back.
Possiamo anche sentire Dai.
Ait, do you have collected some comments in the meantime? Do you want to comment on the form?
Sorry, no, we didn't, so far we didn't any answer, but I guess it was a little challenging to do it. So please take some time. It's very easy to go through it, and any comment feedback is going to be very, very useful for us. So we are going to keep open this probably to the mid next week. So you have some time to try it.
Thank you. Marta, you are back.
Okay, I try again.
I
want to thank everybody for the edition organized in Bologna. It was an edition very rich of ideas, and this approach, the Municipality of Bologna is very inspired about this approach, because with the City Institute has collaborated in different editions at ANCI level, and inside ENLIGHTENme project was a new challenge to try to sow some seeds among colleagues of different departments and among city districts to raise awareness about this new approach in order to change the mindset and on the issue of policies about well-being and health. And so really we try to go on and to raise awareness again. Thank you to the Health City Institute, and also the opportunity inside the ENLIGHTENme project to further disseminate this holistic approach.
Thank you very much. I don't know if there is someone from Amsterdam who wants to speak or not. I would like to take the chance to thank the cities, because they were very, very involved and active in contributing to all the activities that we have described today. So a big part of the success of the project is also up to their collaboration and their continuous support to all the activities. We have some minutes for comments or questions if you want. If not, we would like to thank everyone very much. Oh, yes, Jennifer.
Oh, hello, thank you. This is actually a question for Deborah Cosentino or Francesco Nonnino, if they're still on the call. It's just a little small question about the neck-worn sensors that the subjects were wearing. They're still on the call.
Someone from the group, yes, Deborah is here, and there is also Chiara Lamorgia. So we have someone you can try to ask.
Okay, so I'm just wondering if there's any plans to use that neck sensor data to determine whether the subjects, the participants, were compliant with their use of the intervention luminaire. I think it's self-reported data we were seeing in Deborah's slides. I think it'd be really useful to compare actual light exposure to all of the dependent measures. I think you'll get some really interesting results if you can analyze those data.
Yes, yes, the data that I showed was self-reported, and participants were wearing the necklace before the light intervention and after the light intervention. So during the 12 weeks of light, they were not wearing the actigraphs. But during the follow-up, the first week, we asked them to keep using the lamps while still using the actigraphs. But it's not that obvious when we look at the necklace data when they are actually exposed to the lights. So we could try to combine what they reported with the necklace, but I don't think we can have a measure of compliance using this data. But
when we use neck sensors, we can see very high light levels when the subjects sit down in front of the light source we provide them, or if they go outside. We have multiple channels on the sensors, so we can kind of see the spectral characteristics of the light and estimate whether they're outdoors or actually sitting in front of our light source. So that it's tedious, but I think you'll get great results comparing if you can actually show that they are getting light in the area around their eyes and not just walking around their house or pushing the light far away.
Yeah, but they were also not asked to sit in front of the lamp. So this was not a controlled study. They were only asked to use the lamp where they are, but they were not sitting in front of the lamp. We don't know exactly how they were using it.
So that's a limitation of the study, is we don't know whether the intervention actually did provide light at their eye as a result of those were the instructions.
Yeah, it was taught not to give this kind of, to design the light intervention, like to ask to the people to sit just a fixed distance in front of the light, just put the light in the room where they used to be most of the time and turn the light. But there was not, because of the, natural environmental way of putting the light intervention, which was not designed for the usual trials that you are mentioning. I don't know if Francesco wants to add something or someone else.
I'm sorry, but I disconnected for the very minute when the question was posed. So if you can summarize it again.
Oh, sorry. Just was wondering if the necklace, if you're able to analyze the results from actual light exposure compared to all your dependent measures, PSQI, activity, interday, all of your variables. If you can actually see how much light people are getting, I think you'll get great results and you'll show a lot of significance if you can analyze those data.
Deborah can answer better than me technically, but yes, the short answer is absolutely yes. And we started.
I look forward to seeing more.
Yeah, and we can say how much light they were getting, but we cannot say that this light is from the halo lamp or not.
Thank you. Grazie.
We didn't want to change the habits of the people, so the idea was to have them going on with their normal activities So not to have them inside the room and controlled while dealing with this light exposure. So the challenge was just to have them feel free and comfortable by doing their everyday activities while using the lamp. Any other comment or question? So thank you again for your patience today to listen to all what we have done, to all the partners for their work, and for the possibility to show these results of this collaborative project that will deliver the final document in a few weeks. Then we undergo the process of review under the European Commission. So some of the materials we have shown to you today will be available later in May or June, because we have to wait for the final approval. But please stay in touch with us through social media and the website, because we will be able to show you more and the details of what you have heard today. Thank you very much again to everyone, and have a nice evening. Bye.
Bye.
Thank you very much.
Bye-bye. Thank you.
Bye. Thank you.
Bye.
Bye. Bye.